Hey everybody, my name is Alexis Menendez. I want to take this opportunity to welcome you all to my collaboration on leadership reflection video. In this video, I want to reflect on the time when I participated in like a multidisciplinary teamwork and discuss the positive and negative aspect of my experience. What I was working as RN in skilled nursing facility, I had a experience with multidisciplinary teamwork that I want to share with you. This institution where I was working as RN had close to 300 beds. Older adults with diagnosis of Alzheimer's disease made most of the patients in the unit. A couple of LPNs, one registered nurse, and five nurses and assistants work each shift. There was three shift nurses a day. So what I was working, I hear Mr. Lopez. He was one of our patients, coughing really bad during his meal. Even though he finished his meal without any episode of coughing or choking after that. I was not, I was really concerned, and I talked to my nursing supervisor in the building, and I talked to other nurses too. I also contacted the doctor who recommended keeping a close eye on the patient to make sure that it would happen again. I informed the other nurses to during report and things like that, and we all keep a close eye on Mr. Lopez. But once again, he had a difficult swallowing at dinner. Um, he's begin like coughing with each bite of food. So, for additional assessment, he was sent to the hospital. It was kind of like a protocol. After a week, he was readmitted to our unit with a diagnosis of dysphagia, like soft diet, thick nectar liquids diet was ordered for him. After a few days of stability, another choking episode happened. After being released, he returned into the same hospital where he was previously hospitalized. His dysphagia diet was reduced even more, like a pure and honey liquid diet. People around him began to notice how forgetful he was, how confused he was. He started to getting really weak. Um, lost mostly all his strength. He needed like help to get out of bed, into bed, bathroom, going to the wheelchair. He was diagnosed with aspiration pneumonia. All of this took place in like 2 3 weeks after each stay in the hospital. Like Mr. Lopez was given like a swallow examination by the speech therapy. His diet needed to be double checked to make sure it was right. It was the right consistency. He required physical therapy because of his weakness. He even got dependent oxygen dependent. Um, Blood pressure was fluctuating. He needed to take more medication. So as a result, he was like sent to our facility subacute wing. And then we started investigating, and kind of we realized that like four similar events happened in the last 4 months. Um, when I asked other nurses and managers on the floor, they felt like speech and physical therapy. Um, they all they were really unhappy about it. About speech and physical therapy, they emphasized that necessity for additional personnel to ensure like attentive and ongoing monitoring. I felt kind of like compelled to learn more about the patient care and uh, procedures and things like that in the unit. So as far as I could tell, like speech and swallow PTOT eval were only performed upon readmission to the institution after a hospital discharge, an initial hospital admission, or after like a shocking occurrence. Like additionally, there was no additional personnel present and meal times or lobby hours to do extra supervision. And so, in my opinion, it was time to take action, trying to change a few of those things. Our patients needed more help. The facility director of nursing and I had a like long conversation about my worries because of the need for coordinate effort. She agreed to have like a conference with like kind of like everybody, like all the team members, like nursing supervisor, managers, directors, kind of like nutritionists, PTOT, swallow. We try, you know, gather everybody together so we could have a good meeting and we could talk about all that. So seeing like frontline workers provide the first assistance, you know, having them on board kind of like allow for like a more in-depth look at the situation, like team team intervention that have been successful in the past and the ones that are used currently need to be addressed, such health health issues including like Mr. Lopez situations, where this we're discussing, you know, Lang. The purpose of the gathering was to deliberate on the value and timing of future assessment in the speech and physical therapy and nursing. Following the discussion, action was taken to review the long-term care facility once a month or more if necessary to avoid similar incident, you know, to happen, to be able to provide a better care for our residents. But in the following weeks, we began to put in this plan into action. It took some time to get everything ready, but we were able to do that. So, like for example, like all patients, especially those in need of long-term care, should be assessed at least once a month. It's recommended that people at high risk undergo assessment more often. Registered nurses, speech therapists, and physical and occupational therapists will conduct the necessary assessment. All staff will be notified by email. They will be meeting to brief everyone on the situation and address any issues they may have. Like letters informing patients and social service will send to their loved ones, you know, to keep them updated. More personnel will be assigned to the floor so patients could be watching more attentively. Between 8 a.m. and 8 p.m., each unit will have additional registered nurses and nurse assistant, which will be a big help too. So, uh, patients either they were going to eat their meal and spend most of their time in the lobby. Like more therapists would be booked as much as they could to help with number assessment and treatments. Patient with dysphagia or high risk stroking, or gum or amazing dentures will be close monitored by the dietary dietitian. It was emphasized that the nurse in charge should routinely visit each floor just to make sure everything was working right. Like each month, then the nursing staff was going to meet with the therapies and dietitian and all this staff just to make sure everything was working to see if there was anything needed to be adjusted or not. Like a short meeting was placed on the day this care plan was implemented. The plan objective were discussed as a group. You know, everybody was on board. Therapies, dietitian, like everybody. That was very important. That was the most important thing, that everybody knew what was going on. You know, the objective was to for deliver like care in which these team work together to provide the best possible outcome, and the ability to work together effectively is paramount importance in this type of crisis. When people don't work together, time, money, energy may be wasted without any, you know, hiccups. In our ability to work together, we were able to accomplish our aims. The cost of hiring more workers is one example. However, this was necessary. You know, without no amount of money spent on the healthcare will be worthwhile. Low levels of interprofessional cooperation harm healthcare delivery show by Reeves, 2017. It's crucial to work together to ensure the health and safety of patients, and failure to do so may have dire implications. The use of interventions such as interdisciplinary meeting, checklist, and a communication tool has been found to increase teamwork among specialties. Care is improved when a team of like healthcare professionals such as like physicians, nurses, and nursing aides meet with patients face to face. The multidisciplinary team meeting, Sullivan, like 2015. On the other hand, a lack of teamwork may lead to subpar patient care, and as these presentation shows, even more incidents of this kind. Um, According to 2016 essay, like enumerates method of abilities that promote effective teamwork. He believed that the finest multidisciplinary cooperation among healthcare professionals may be achieved by combining teamwork and knowledge of the talents of colleagues. Like cooperation between healthcare professionals is essential to deliver high quality treatments. So like each multidisciplinary team include the leader should be aware of their own colleagues' strengths and shortcomings, like have sympathy, like use a good communication skills, work together with people, consider like opinions of your coworker, and respect staff and their efforts, the effort. I always remember that healthcare team member from transporters to physician. It's in integral part of the team since they all strive to achieve the same goal. Like a paper title like "Working as a Team to Ensure Patient Care" by Bobby K 2014 highlight the significance of teamwork in achieving successful result and safety. In conclusion, like the majority of the treatment work is intended. Care was taken to check in on the patients and make sure, like, promptly, all the regulation, everything was right. They appreciated the additional attention and treatment time. They enjoy like socializing with new people, having regular check-ins. Um, the fall rate dropped. The actions were also made with praise from patients and loved ones. Family have expressed more happiness with the care they get from their loved ones. However, a small number of patients expressed anger when they asked to do more or when they were like monitored more. But patients received more assistance and supervision, which is it was good. That's why we were looking. Why the the added cost of the all the new employing was kind of like the downside, but the director of nursing was able to meet the demand after she saw the great outcome that who have gotten carefully for careful monitor or patients. So thank you very much. This is the end of my presentation.